Hi there. My name is Dr. Swanson. What brings you in today? Just a basic checkup and a cranial nerve exam. Wonderful. Not many people get those done anymore. And you're also feeling a bit under the weather. Okay. We'll take a look at you and make sure everything's functioning just fine. I'm just going to go ahead and ask you a few questions real quick before we get started. Do you smoke? Wonderful. Do you have any family history of illness or disease? Diabetes? Okay. Do you have any allergies? No? When was your last checkup? January? With Dr. Hart? Okay, wonderful. Do you have a history of illness with yourself? Anything that... No? Okay. Any mental health diseases? Depression? Okay. Are you being medicated for that at the time? No? Okay. And have you been medicated for it in the past? Excellent. Okay. Wonderful, wonderful. Okay. I see on the chart that the nurse did not take your vitals yet, so we'll go ahead and do that real quick before we get started. Okay. I'm going to go ahead and listen to your heart. Make sure everything's ticking just fine. Do me a favor and just breathe normal for me right now, okay? Sounds great. I'm going to go around the back real quick. And take a deep breath in for me. Great. Go on the other side. Deep breath in. Okay. Everything sounds great. And take your pulse real quick. Just hold your arm out flat for me. Take your blood pressure as well. Alright, go ahead and lay your forearm, palm out again for me. Thank you. You have a tiny arm. 120 over 80. Absolutely perfect. Okay. I'm going to go ahead and just feel your glands real quick, your adrenal glands right there. They are a bit swollen. Might be why you're feeling a bit under the weather. It is cold and flu season after all. Okay. Do me a favor and just open your mouth very wide and say ah. Okay. Okay. Everything looks fine. Okay. I'm going to take a look at your eyes right now. A little closer. Open your eyes as wide as you can. This is going to be a little bright, but for the moment, just look at my nose if you would. All right, if you'll look up for me. And down. Okay. To the right. And to the left, please. Great. They look fantastic. We'll do another thing with the eye real quick. I'm going to ask you to please cover one eye for me. Perfect. And what I'm going to do is I'm just going to flash the light in and out of your vision just to see how your pupil retracts and refracts, okay? Perfect. Cover the other eye, please. Great. Your eyes are in tip-top shape. All right. I'm going to take a quick look in your ears. Make sure everything's looking all right. Look that way for me if you would. Okay. And the other way, please. All right. Your left ear does appear to be a bit inflamed. Have you been having any trouble with it lately? Has it been hurting you at all? Okay. I'm going to just lightly press on it real quick. Does that hurt? A little bit. Just a little bit of pressure. Okay, that's fine. Just trying to get a feel of what's going on with you. Okay. Those are that's the basic checkup. I am a little concerned that you might have a bit of an ear infection, and I'll write you a prescription at the end of this. Just because your glands are swollen and your left ear is a bit inflamed. So we may as well just go ahead and get on with the cranial right now. Cranial exams are very easy. You just answer me honestly and just do what I say. It's very simple. All right. We are going to start with a smell test. Actually, I might need that. We'll start with the smell test. And I'm going to wave a cotton ball in front of your nose with an unknown smell on it. And I just want you to tell me what that smell is, okay? All right, here's the first one. Absolutely perfect. It's vanilla. All right. And the next one. You're not sure? Try it again. It is orange. Some people confuse that sometimes with another kind of citrus fruit, but you're perfect. You hit the nail on the head. And one more. Perfect. It's pine. Wonderful. Good job. See, it's not so hard. Okay. Just some basic questions. Can you tell me the color of my shirt? What's the color of my hair? To the best of your guess. Right. And the color of my eyes, please. Blue. Perfect. All right. Next thing I'm going to have you do, I'm going to have you look straight at my nose. I'm going to have you follow this pen only with your eyes. Okay? Follow this with your eyes. You don't have to keep looking at my nose, just making sure you're focused. Follow the pen with only your eyes and not your head, okay? All right. Perfect. Okay. All right. Next thing I'm going to do is check your hearing. A couple times during this, actually. It's mostly just to make sure you're conceiving things very... Conceiving, is that the right word? It's been a long shift. Make sure that you're hearing things properly and that you're understanding them properly. I'm going to take my fingers and I'm going to snap them by your ears. And I want you to tell me when you don't hear snaps anymore. Okay? Great. Perfect. Great. All right. I obviously need to get a side table here, don't I? I'm going to do one ear at a time. Great. Okay, one more time on each side. Okay. Perfect. Absolutely perfect. Okay. Can you raise your eyebrows for me? Wonderful. Can you smile? Can you frown? I'm not a very good frowner either. Some people are very good at that. Just did just fine. Okay. Next thing I'm going to check is your peripherals. I'm going to be showing you numbers in your peripheral vision, but I want you to be always looking at my nose, okay? Always at my nose. And when I show you a number on the side of your peripheral, I want you to tell me what it is without looking at it, okay? Ready? Look at my nose, please. Wonderful. Perfect. Absolutely perfect. All right. Oh, it's starting to rain out there. Okay, next thing I'm going to do is I'm going to whisper some numbers in each of your ear. I'm going to do this a couple times, and I want you to repeat the numbers back to me in the order that I told you, exactly as I told you. Okay. 4, 1, 7. Perfect. 6, 8, 1. Great, great. 2, 6, 9. Mm-hmm. 1, 5, 7. Perfect. Okay. Again, I'd like it if you look straight at my nose, not anywhere else. I'm going to hold these 2 fingers up, and I want you to tell me which one is wiggling, just by looking at my nose, okay? Perfect. Okay. Next thing I'm going to be doing is checking your facial nerves. I'm going to be using a small tool. It's not sharp, but you will feel it. And that's the whole point. I'm going to lightly tap your face in certain areas with this tool, and I want you to tell me if you feel it and when you feel it, okay? Mm-hmm. Mm-hmm. Absolutely perfect. All right. Last thing I'm gonna have you do. Can you puff out your cheeks for me? Can you purse your lips? Good. Can I have you puff out your cheeks again for me? And what I'm gonna do is I'm gonna try to push your cheeks back in and have you blow your air out, okay? I don't want you to let me do that. So hold it. Perfect. Wonderful. Okay. Well, aside from your swollen glands and inflamed ear, you are psychologically perfectly healthy. I'm going to go ahead and write you your prescription for that ear infection, which I think is what it is. We'll get you some antibiotics and some anti-inflammatories. So I'll go ahead and write that right now. You're going to take this 2 times a day at the same time for 10 days. Just to make sure that we get rid of that infection. Make sure you always finish your antibiotics. You never want to skip on that. So. There's that. Other than that, everything looks perfect. You are the ideal weight. Your blood pressure's perfect. Your temperature's normal. May not stay normal if you don't take those antibiotics, but everything else looks fantastic. You're very healthy. And I'll go ahead and make sure the nurse puts you in for a checkup 6 months from now, okay? Wonderful. Okay, I'll go ahead and send the nurse in. I'm going to run out, get this prescription called in, and she'll come back with a survey for you and your checkout. Okay? Thank you so much. It's nice to meet you. Stay healthy. Take care of that ear.